The Ministry of Health, through its National Mental Health Program and in collaboration with UNICEF, convened a two-day validation meeting on Monday to review the draft Gambia Mental Health Policy 2024 held at a local hotel in Senegambia. The event brought together key stakeholders from the health sector and partner institutions to assess and finalize the new policy framework. The last mental health policy was adopted in 2007 and has since become outdated in response to the evolving landscape of mental health needs. The revised policy reflects contemporary challenges, integrates evidence based practices, and reinforces the Gambia's commitment to delivering equitable and accessible mental health care. In recent years, mental health has gained increasing recognition as a national public health priority. The country has witnessed growing awareness, heightened demand for mental health services, and increased advocacy from both governmental and civil society organizations. The newly drafted Mental Health Policy 2024 aims to establish a more comprehensive and integrated approach aligned with international best practices. It focuses on strengthening mental health governance, capacity building, public education, and reducing the stigma associated with mental illness. Speaking at the opening ceremony, the permanent secretary at the Ministry of Health, Dr. Yusufa Toure, emphasized the importance of the validation process.
Mental health is a right, for everybody, and we have to start taking it seriously. I must say, shortly after I joined the ministry, I have seen some performance audit, report, of the national audit, on a number of mental health cases, and it is concerning, and I think as a country, we have to, take those things very seriously, because it is the only situation where, you have nothing against them no matter what they did. So it is therefore with great honor that we gather to validate the Gambia's mental health policy draft, 2025. And this moment represents our collective commitment, to build a nation where mental health is prioritized, stigma is eradicated, and compassionate care is made accessible, to all. And as a ministry and as government, we extend our deepest gratitude, to UNICEF for this invaluable technical and financial support, you have extended, to the country and to the Gambian people, as a whole, which has been instrumental in bringing this critical policy to fruition today.
Mamjara Marega, Program Manager of the National Mental Health Program, highlighted the urgency of addressing stigma and promoting community support for individuals living with mental health conditions. She stressed that inclusive care and awareness are essential for advancing mental health in the Gambia.
17 years since our 2007 policy, we stand at a critical juncture, armed with lessons learned and determined to do better. The 2007 policy laid an important groundwork, but implementation showed there are critical gaps. Let me highlight some of these gaps. Limited mental health services, community mental health services were materialized. Mental health services are largely centralized, leaving regions such as North Bank East and West and CRL understaffed. Chronic underfunding, with less than 2% of the health budget allocated for mental health. The community, as well as engaging the communities to reduce the stigma, efforts lacked sustained community engagement.
The UNICEF Deputy Country Representative reaffirmed the organization's commitment to supporting mental health services, particularly for vulnerable populations, noting that mental well-being is essential to the overall development and protection of children and young people.
As we all know, mental health is a cornerstone of overall well-being, and its importance cannot be overstated. Therefore, the review and validation of the National Mental Health Policy marked a significant milestone in our collective efforts to ensure that every individual, especially children as access to the mental health support they need.
Other speakers, including Honorable Amadou Kamara, Chairman of the National Assembly Select Committee on Health, the Deputy Director of Health Services, praised the policy validation as a vital step toward advancing mental health governance. They underscored the importance of bridging treatment gaps, enhancing service delivery, and promoting a rights-based approach to mental health care. Reporting for Kirfatu, I am Fatu Silla.